Hi, my name is Kate Turk, and I'm a second-year medical student at the University of Washington School of Medicine. This summer, I had the opportunity to complete a global health project focused on increasing access to stroke education information for patients in rural Peru. The title of my project is Development of a WhatsApp-based pilot program to improve stroke education and risk factor reduction in patients with arterial hypertension in Huaral, Peru. Often when people think about global health issues, their mind first goes to things like infectious diseases. But in Peru, which is a low to middle income country, cerebrovascular disease and stroke are actually the second leading cause of death. In Peru, there's a severe shortage of neurologists, thrombolytic therapy units, and also access to rehabilitation centers for post-stroke patients. It's extremely important to find ways to reduce patients' risk factors for stroke with such a high burden of disease. So I think that WhatsApp, which is a very popular and common communication app used in South America, provides an exciting opportunity to disseminate health education information to patients. So the aim of my project was to develop materials for a WhatsApp-based pilot program to improve stroke education and risk factor reduction in patients with arterial hypertension living in Huaral, which is a region just to the north of Lima that is a very rural town. In terms of the methods used in this project, I first conducted a stakeholder analysis to identify key partners whose input would be essential in creating the project. Two of the largest players here were Dr. Carlos Abanto, who is the Director of Research in Cerebrovascular Disease at the National Institute of Neurologic Sciences in Peru, as well as Arantxa Sanchez, who is a medical student in Peru with a focus in neurology. Dr. Abanto has contacts in Huaral within the education department as well as hospital administration. So that's why we decided to pursue a project that would serve people in Huaral. We next found a cohort of patients with arterial hypertension, and this was identified by the Huaral Hospital Teaching and Training Unit Director. And we thought a group of patients with arterial hypertension would be appropriate because hypertension is the #1 leading risk factor that is modifiable that causes stroke. Next, we created digital infographics addressing stroke awareness and risk factor reduction. And to create these, we utilized information from the National Institute of Neurological Sciences in Peru, but also the American Stroke Association. And the reason we decided to use information from an American source was because in Peru, they actually use American standards of care when treating patients. And also in Peru, there's no current stroke program. And so Dr. Abanto thought it would be a useful resource to use American Stroke Association resources. And I'm going to go through these specific digital infographics themselves. I wrote each of these and then had Arantxa edit them first, and then also had Dr. Abanto edit and approve them for medical accuracy, as well as cultural appropriateness, and also making sure that it was an appropriate reading level for patients. This first infographic focuses on understanding what a stroke is. So it talks about the two different types of strokes, ischemic strokes and hemorrhagic strokes. It talks about the burden of disease in Peru being the #2 cause of death, and also the fact that 80% of strokes are preventable. It talks about other names that strokes may be called in Peru, so ictus or ataque cerebral. It talks about how to recognize a stroke, for example, a drooped face or a dropping arm or slurred speech. And lastly, this infographic addresses that it's important to seek medical attention immediately if you or someone that you know seems to be having a stroke, because treatment within 4.5 hours is essential. The second infographic focuses on high blood pressure and how it increases the risk of stroke. It explains what high blood pressure is, what normal values are, why it increases the risk of stroke, and also the fact that hypertension is the most important modifiable risk factor in preventing stroke. It explains here that at 50 years of age, people that do not have high blood pressure, on average, will live 5 more years than people who do suffer from high blood pressure. Lastly, this infographic talks about how to reduce high blood pressure, things like diet, exercise, managing stress, quitting tobacco use, taking prescription medication that treats high blood pressure, and limiting your use of alcohol. The next infographic talks about diabetes and how diabetes increases the risk of stroke. And the main focus here is explaining why high blood sugars affect blood vessels and can cause stroke. It explains on this infographic that it's important to control blood sugars to prevent stroke, and how it's important to work with your medical provider to control diabetes. The next infographic talks about smoking and drinking alcohol, and that it's important to limit these substances in order to prevent stroke risk. And lastly, the last infographic focuses on a healthy diet and exercise in preventing stroke risk. Other than the infographics, I also created an informed consent that was adapted to WhatsApp that could be sent prior to the intervention. I also created pre and post program surveys that addressed comfort using WhatsApp and the patient's understanding of stroke. And these surveys could be sent pre and post intervention and compared after the program was over to understand how effective the program was in educating patients about stroke and stroke risk. I also created a detailed program outline, which could be used by hospital partners in Huaral when completing the program. In conclusion, throughout this project, I created materials for a WhatsApp-based pilot program aimed at improving stroke awareness and risk reduction for patients with hypertension in Huaral, Peru. This program could provide a sustainable means to improve stroke education while limiting travel and financial burdens with patients living in rural areas. And I think that if successful, this program could be replicated in other areas of Peru as well. It could also be replicated domestically in Spanish-speaking communities. So I think it is a really interesting opportunity to improve stroke education throughout the Spanish-speaking community. Thank you for listening.